Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Pharmacist in Jigawa says vaccines have been saving lives for decades and the COVID-19 vaccine is no different. Adamo State vaccinates over 200,000 persons, targets hard-to-reach areas. And Swedish Social Democratic Prime Minister tests positive for COVID-19 shortly after Swedish royalty. Thank you for joining us. The number of confirmed COVID-19 cases in Nigeria has surpassed the 250,000 mark. According to the agency's update for January 13th, the new cases were recorded in 16 states and the Federal Capital Territory. There were no deaths recorded. Meanwhile, according to the National Primary Healthcare Development Agency, over 12 million total eligible persons targeted for COVID-19 vaccination reached the first dose, while over 4.9 million of total eligible persons targeted for the vaccination are fully vaccinated. Here's more on the pandemic update.
423 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 16 states and the FCT, indicating a drop from the figures reported earlier. Lagos accounted for the highest number of cases with 120 infections. Rivers had 118 and Ramba had 38. The FCT and Gombe came in with 31 cases each, while Kaduna reported 21 cases. Oyo had 14 infections. Benue and Cross River had 11 and 10 cases. Kwara, Borno, Kano, Bauchi, and Jigawa are some of the states reporting single-digit infections. Nigeria now has a total of 250,009 cases. 364 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 203. There were no additional deaths recorded in the last 24 hours, leaving the fatality toll at 3,092. Currently, there are over 25,000 active cases in Nigeria, while more than 3.9 million samples have been tested so far. With over 16,000 active infections, Lagos State accounts for the highest number of cases on admission, followed by the FCT and Delta State. 10% of eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while 4.4% of the population have been fully vaccinated. The total global confirmed cases have surpassed 320 million, and deaths are beyond 5.5 million.
And COVID-19 vaccines are now proven to be safe for everyone, despite the conspiracy theories by some members of the public. This is according to pharmacist Ubale Hashim, who spoke to Channels Television in Dutse, the Jigawa state capital. According to him, every vaccination comes with a similar attitude from the people. However, the result thus far is positive.
Some of us were sorted with mumps and others. We were all sorted out, and those with the mumps, they were taken for treatment. Some with leprosy, they were moved to Yadokunya Hospital in Kano. And then there were the vaccines for smallpox, for chickenpox, masukazwa, the soldiers, do what and there was nothing. Except the best came to our communities. Really, many people, Kazwar and other smallpox and just disappeared. And there was no mass burial as a result of vaccination. That was one. Then the cholera. Every time there is cholera, is running helter-skelter vaccination all over, and nothing happened. There was nothing. I am giving you a layman's approach to this issue, So as far as I'm concerned, that one has convinced me a vaccine is safe.
From Jigawa to Adamo State, where the government has commenced mass vaccination across the 21 local government areas. This was disclosed by the Director, Immunization and Disease Control, Adamo State Primary Healthcare Development Agency, while speaking to Channels Television in Yola. According to him, about 298,500 persons have so far been vaccinated in the state, and already a structure has been put in place in communities that will get to hard-to-reach areas to ensure service delivery of the vaccination exercise.
Since the commencement of the COVID-19 vaccination exercise, one of the major challenges has been vaccine hesitancy. That is now being overcome with the mass vaccination campaign embarked on by the Adamo state government. Those who are 18 years of age and above are eligible to be vaccinated. This is to improve immunity, thereby suppressing transmission of the virus. Governor Mad of Interior also leads by example by taking his booster jab and encouraging citizens to do so. A visit to some of the vaccination centers shows that the exercise is in progress as people are seen coming out to get vaccinated. The vaccinated staff keep close tabs on people getting vaccinated in their centers.
I enjoin all Nigerians not to be frightened, not to be afraid. I do the first and the second dose, and there is no problem. And I'm here for the second jab at nobody's invitation. Actually, I had to come from Gui just for the records to be here. And I'm going back, and I'll be back here on the 28th of February to take the booster dose.
As of today, we have vaccinated about 21 new cases, and the second dose 13, the booster dose about 7. So far, from the beginning to this time that we are vaccinating people, we have vaccinated about 4,389 people.
A worrying factor has been the hard-to-reach areas in the state.
The demand creation and at least mitigating rumors in terms of the COVID-19 virus have been put in place in such a way that the leaders, like if you are aware, the governor was in public hospital where he was vaccinated, and that created demand for people to come to hospitals and even avail themselves in mass vaccination centers.
Over 200,000 persons have been vaccinated, but more are being encouraged to avail themselves of the exercise. To achieve maximum coverage, about 339 teams across the local government areas, the religious, traditional and community leaders have been mandated to ensure that the people turn out for their vaccinations.
A new study has identified cannabis compounds as a therapeutic agent to prevent coronavirus infections by blocking the virus. And this is from entering human cells. According to the study's authors, widespread use of these compounds from pot plants and a vaccination regime could help fight the virus's spread and the disease it causes in people who get infected. Well, joining us from our Abuja studio for more on this is Biola Ajenifuja, a pharmacist. Welcome to the program.
Thank you.
What's your take on this study?
Yeah, you see, cannabis has been around for long. Is a drug, is a plant, an herbaceous plant that is indigenous to the Central America and Eastern Asia. Some of the known species are cannabis sativa and cannabis indica, but now it's cosmopolitan. You can see it being grown everywhere. That's our common India hemp that they call India hemp here. So it has some medicinal property because there are some compounds in it that are not really psychoactive, because ones that are psychoactive are the ones that alter the moods. So these are we call it the THC, that's tetrahydrocannabidiol. That's one that alters moods, that causes hallucination, cognitive behavior, and negative psychiatric behavior. But the medicinal part is the one we call the CBD. It has been in Nigeria for more than 5-6 years. CBD oil is available in oil, gels, and patches. So this study done in Oregon State University in the College of Pharmacy, led by Professor Van Bremen, who is a professor of medicinal chemistry. They realized that and two acid compounds isolated from this cannabis, that's CBDA, that's cannabidiolic acid and cannabidiololic acid. They have action against SARS-CoV-2. How were they able to detect this? They isolated the compounds, then they culture it with a live virus of the SARS-CoV-2. After 24 hours, these were injected into the epithelial cells, or human epithelial cells. So they realized that it inhibited the growth of there was no RNA of the SARS-CoV-2, which means it has therapeutic action and also prophylactic action. That means it can prevent the spread of COVID-19 and it can treat it. So this is a major breakthrough. So for us not to have resistant strain, I think a combination of this with vaccine, with the vaccine, we will provide an unpalatable situation, an unpalatable environment for the SARS-CoV-2, so that it will not have an environment to thrive in. And with that, we can be able to nip this in the bud and be done with this.
So the findings, we understand, also point that it is also virus neutralizing. Some people have argued that this report is at best preliminary. Do you think that there is a future, that this can be a potential drug pill that can fight COVID-19?
Yes, because like a CBD oil that I told you has been in existence for long, is the drug that has a variety of uses, especially for chronic diseases, and it has it boosts the immunity because of its antioxidant properties. So it's used as an antiviral. And you know this SARS-CoV-2, which is the causative agent of COVID-19 that we're talking about, is a virus. So for it to have an antiviral action, and this has even been proved because it has been published in the Journal of Natural Products, and it has been peer-reviewed. So it has been peer-reviewed. So it means it's really active. So I think what we need to be done now is to see other compounds in this cannabis that can be effective against it, and how we can mass produce this, and also the legislation on ground, so that the THC, which is the psychoactive one, will not be the one that will get into the wrong hands. Rather, is the medicinal one, is the one that will get the common man, which will help us to treat this COVID-19 and prevent the spread. So I think I see a future in this drug, this cannabinoid derivatives.
One also wonders, seeing as it's, well, still illegal, to use cannabis here in Nigeria, and there's a lot with regards to legislation on whether for recreational use or for medicinal use here in Nigeria. But is there hope that such natural products can be developed further, and not just cannabis, others as well, as a solution to diseases outbreak? How much is Nigeria putting into these homegrown solutions?
Yeah, right now, the legislation is still strict. But the CBD oil is in the market, and most of the CBD oil are being imported. The CBD is the cannabis diol, which is the one that is not psychoactive. The THC is the one that is psychoactive, and both are found in this cannabis. So what we can do in terms of legislation is it should be grown in a controlled area, where as they are being harvested, they are taking out the THC, that's the one that is the psychoactive, so that is the CBD, that's the one that have the medicinal property that doesn't affect the mood, that is not psychoactive, that don't have tendency of addiction, the one that doesn't cause negative psychiatric situations. So they are the ones that should that should get to the common man. So still legislation should still be in place so that we don't get that THC, that's the tetrahydrocannabinol, into the wrong hands, so that one of our youths we know what India hemp can do to our youths. And they're our future.
Indeed. It would also be nice to know what the NDLEA will have to say on this, and also the National Assembly, since the bill is still there to legalizing cannabis for medicinal use. We'd like to thank you, pharmacist Viola Ajenifuja, for always joining us on the program.
Thank you. The pleasure is mine. Do have a brilliant day.
To you as well. Still to come, The Omicron variant is now the dominant one of COVID-19 in Germany. We have that story and more when we return. Welcome back. After a stark warning from the WHO that half of Europe could be infected with coronavirus in the next 2 months, infections are surging across the continent. The Robert Koch Institute has reported another daily record of new infections with over 92,000 new cases and 286 new deaths. At 470.6, the 7-day incidence of infections per 100,000 people is approaching the record rate of 485, which was recorded in November 2021. Now, according to the country's disease control agency's weekly report, the Omicron variant is now the dominant one in Germany. The highly infectious variants made up 73.3% of cases in Europe's most populous country, up from 44.3% the previous week. While other European countries have declared the arrival of the variant tantamount to the virus moving its pandemic to endemic stage, Germany's government has struck a more cautious note. Well, joining us to talk more about the situation in Germany, Chelsea Delani is the Deutsche Welle correspondent, and she joins us from Berlin. Hi, Chelsea. Germany has been setting new infection records daily this week. What are things like on ground there?
Well, I think this warning from the WHO has been really a reality check for all of us here in Europe that the Omicron wave is beginning to break. And what that means is sharply higher levels of COVID-19 infections. We've seen new records being set here in Germany for the past 3 days. Today, Germany has reported 92,000 new COVID-19 infections. That's compared to about 56,000 a week ago. So we are seeing a very sharp increase in the number of infections. We've also heard overnight from the Public Health Institute here in Germany that Omicron is now responsible for about 73% of cases. That's compared to 44% last week. So it is spreading, and a lot of people are getting infected. The number of infections certainly higher than anything we saw during the Delta wave or any of these previous waves here in Germany. But the bright spot does so far seem to be that it's not leading to vastly higher levels of hospitalizations or deaths. So we've seen this in other countries that have been dealing with Omicron waves. Even though many people are getting infected, it doesn't seem to be as deadly as Delta. That seems to be the case surely here as well. The hospitalization rate, and this is calculated, the number of people who have been hospitalized per 100,000 residents here in Germany is at about 3 right now. Back in December, it was actually much higher at about 5 to 6. So that does seem to be one of the more optimistic messages from this Omicron wave that is certainly having a big impact here now.
We understand another issue seems to be that labs are being overloaded with coronavirus tests. How is this being handled?
Well, certainly as the number of infections goes up, the level of testing goes up, and that's putting a lot of pressure on laboratories here in Germany, particularly in the north of the country. Many say that they have seen the number of lab samples that they've been receiving basically quadruple in the past week. Basically right now, Germany has a testing strategy where many people are doing daily or weekly or otherwise quite often these rapid antigen tests. These are the ones that you can do yourself or you can go to a facility, but they're pretty easy to access here in Germany, and you need them often to go to work or to go to a bar or to a restaurant. But if you test positive for those, then you must do a PCR test. These are generally more accurate. That's where we're really starting to see the bottlenecks right now. So last week, the laboratories did about 1.4 million PCR tests, and even though they say they do have capacity to do even more than that, and they do have the materials, the problem right now is in labor. So many people who work in these labs are being infected with Omicron as well, and that means that they're having trouble keeping up with the number of tests. The government does have some difficult choices to make because clearly we're having trouble keeping up with this level of testing. They've said that they likely will try to prioritize certain groups, particularly people working in healthcare, people working in hospitals, nursing homes, as well as people working in other types of critical infrastructure, and of course people who have been symptomatic. but this is not an easily solved problem, and there likely will have to be some sort of prioritization and rationing of these tests.
And Chelsea, I mean, there was supposed to be a goal of hitting 80% vaccination rate, according to the health minister, but, you know, there seems to be a danger to that. What's gone wrong?
Well, one of the problems for Germany is that it does seem to have lost some momentum over the holiday period. Leading up into Christmas, Germany had put a lot of prioritization on increasing the rate of vaccinations. But over the holidays, many people, of course, were busy with other things. So we did see vaccinations really start to fall in that period. They are once again really putting this as a main goal for this new government, and they are to some degree starting to see vaccinations pick up. We saw about 780,000 doses administered earlier this week on Wednesday, and that's a big acceleration from previous days. So it's possible that we're starting to come out of this slump, but overall, Germany is still dealing with a pretty low vaccination rate in the scheme of broader Europe. About 72.3% of Germans have been fully vaccinated. That's far below levels we're seeing, for example, in Spain or Portugal, where it's over 80%. One of the big hopes was that Germany would introduce a vaccine mandate requiring everybody to get vaccinated. That is becoming a little bit more politically difficult. The new Chancellor, Olaf Scholz, says he does want to implement that, but there has been a lot of pushback, and in any case, it likely will be a couple of months until that happens. In the meantime, they are trying to make it very easy for people to get vaccinations, but the 80% goal does look like it could be out of reach, given that right now the vaccination rate is about 72.3, and we haven't really seen that move much over the past couple of weeks.
Chelsea Delaney, Deutsche Welle correspondent, joining us from Berlin. Many thanks. And Swedish Social Democratic Prime Minister Magdalena Andersson has tested positive for COVID-19, according to her spokesperson. Andersson, 54, is one of several party leaders to have tested positive for the virus in the wake of a debate in Parliament earlier this week, while Sweden's King, Queen and Crown Princess have all been hit with infections this month. Elsewhere, passengers from 153 nations have been banned from transiting through Hong Kong airport in the latest tightening of the city's strict antivirus travel measures. Here's more on the global COVID-19 update.
Swedish Social Democratic Prime Minister Magdalena Andersson has tested positive for COVID-19 as a growing wave of infections swept the country, driven by the more contagious Omicron variant. Andersson is one of several party leaders to have tested positive for the virus in the wake of a debate in Parliament earlier this week, while Sweden's King, Queen and Crown Princess have all been hit with infections this month. Elsewhere, Hong Kong has announced that it will suspend for a month transit flights from around 150 countries and territories considered high risk because of the coronavirus, deepening the global financial hub's isolation. The move comes as the city has seen around 50 cases of the fast-spreading Omicron since the end of last year. North China's Tianjin municipality will launch its third round of citywide nucleic acid testing on Saturday after 44 people tested positive for COVID-19 in its second round of mass testing. The municipality of 13.9 million people that neighbors Beijing has conducted 2 rounds of citywide mass testing. In the meantime, the World Health Organization says it's currently reviewing a COVID-19 antiviral oral pill, and a recommendation will likely be made in early February.
So our GDG has already deliberated on the drug molnupiravir, and you can expect to see an update with that new recommendation coming at the beginning of February. And then our GDG is also getting ready to review the data on nirmatrelvir, ritonavir, which is the other oral antiviral that has had data published. And we will be looking at that data in early February for publication, likely at the end of February.
And the head of South Africa's Medical Research Council says Johnson & Johnson COVID-19 vaccine booster shot is 84% effective in protecting against being hospitalized by the Omicron variant for 1 to 2 months after it's received.
In terms of vaccine effectiveness, we're very excited that we saw great protection against hospital admission in our healthcare workers. And so this slide just shows you, as we followed up healthcare workers who were boosted and looked at the durability of the vaccine. So in the healthcare workers that had been boosted just between 0 and 13 days, because your immune system is evolving, we saw 63% protection against hospital admission. In those who had been boosted between 14 and 27 days, we saw an 84% vaccine effectiveness, and we see that this kind of vaccine effectiveness is maintained beyond up to 2 months. And so we are refreshing this data, but very happy to report very high levels of vaccine effectiveness against the Omicron in South Africa. In fact, this is the world's first evidence of vaccine effectiveness with using the J&J vaccine.
The study involved 477,234 healthcare workers, all of them vaccinated with a J&J shot, of whom 236,000, roughly half, had received the J&J booster shot.
Our website, channelstv.com, has more updates and also a better understanding of the pandemic. You can find breaking news stories and others. There you see France to ease UK travel restrictions today and several other stories at your fingertips. And that's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.